Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great exercise for those of you with chronic sacroiliac pain, a simple walking exercise to help both relieve and prevent sacroiliac symptoms. Hope you enjoy. So what a great way to help sacroiliac pain than on a damp morning here in the Appalachians in early winter by including some rehabilitative walking techniques to help. If you have chronic sacroiliac joint problems, you know many times weather changes, barometric pressure changes can irritate because pressure changes outside also change the pressure inside our joints. A great way to reduce sacroiliac pain when you're having it, as well as to prevent it from happening, is to use a walking technique that wakes up the glute medius. The glute medius is a small muscle that runs from our hip up into our pelvis, and it helps to stabilize the hip joint and the sacroiliac joint. Many people with sacroiliac problems, many of my patients that I've treated successfully over the years, and remember, I'm talking from a 93% success rate dealing with lower back pain, have weak glute medius muscles that cause hip hiking, or when you take a step, the hip travels slightly outwards and upwards. When the pelvis or the hip moves out and up, it stresses and shears the sacroiliac. Remember, the sacroiliac is a connection between the spinal bone, the sacrum, which sits at the bottom of your spine, and your ilium or pelvic bone. And that joint, when you hip hike, when the pelvis moves forward and up, moves and creates a shearing or upwards translation of the pelvis on the sacrum, and that shearing force many times is one of the prime culprits to cause sacroiliac pain because you're repetitively stressing the joint capsule, the tendons, all the fascia and the ligaments around that joint. So a great way to change this to not only help prevent sacroiliac pain from happening in the future by strengthening the glute medius, and to also increase your relief if you're having pain presently, is to strengthen the glute medius. Now, a lot of physical therapists, chiropractors, osteopaths, spinal rehab specialists will start patients on clamshell exercises and other glute medius exercises, which are fine, but unfortunately lack the specific target of increasing the coordination of avoiding hip hiking and increasing glute medius strength during the walking cycle. You can do all those exercises in the gym, but unless there's a true carryover into real life activities, they're going to do you very little. So what we're going to do with this exercise is very simple. We're going to look at what's called the tracking distance, or separation between our feet as we walk. Typically, what's going to happen on the side of the sacroiliac problem, the foot and the leg is not going to be positioned under the center of the hip joint. The center of your hip joint or groin should be lined up with the center of your thigh, knee, and foot when you walk. What people do is they give into laziness. The body is always looking for efficiency so as not to use a lot of muscular contraction. So what it does is it takes narrower steps which allow the pelvis to move to the side, and the foot and the leg then is more in position of the center of the body to hold you up. That's a lot easier to do than if you walk with your legs slightly outwards and you keep the hip in. Now it takes a lot more muscular effort to hold you in balance. It's a lot easier for me to put one leg in and walk over it. I could stand there for a long time. If I keep the leg out and keep more of a straight alignment with my hip in so I'm still above the groin, you're going to feel the glute medius is working and there's a lot less stress on the sacroiliac joint. So the tip for today is simply increasing the width of your tracking distance, particularly on the side of your sacroiliac problem. You can start with maybe just a 1/4 of an inch wider stance as you walk and increase that over time to maybe a 1/2 inch or even an inch, so that eventually you're trying to walk with your feet wide enough so that the center of your thigh is lined up vertically over your knee and your ankle. And as you do this, what you're going to feel a lot more hip motion. There's a lot more hip contraction in the glute medius. That's going to, over time, increase the strength of that glute medius, and during the short run, it's going to many times relieve sacroiliac pain, because if your sacroiliac joint is bothering you due to this shearing problem of hip hiking, just increasing your tracking width or distance between your feet as you walk is going to help reduce that irritation and many times simmer down sacroiliac symptoms. As in most corrections for lower back pain, whether you're walking or doing rehab exercise, remember to introduce these changes slowly. Start with a slight change in your width, and don't try to do that for every step of the day. You'll wind up straining your glute medius. Start slowly, build it up, pepper it in a little at a time, and over weeks and months, build that up into greater levels. If you're looking for a great program to figure out what your mechanics are that are aggravating your lower back pain, as well as figuring out exercises to correct those mechanical errors, not only with walking, but also with everyday motions, working out in the gym, check out our Walk-Away Back Pain program. It gives you a full analysis of your walking mechanics, your body mechanics as they relate to your lower back sacroiliac problems, and it also instructs you on how to pepper in specific changes for your unique mechanical errors during walking and also other supportive exercises to help overcome lower back symptoms. That's available, the Walk-Away Back Pain program, at painfreeandfit.com. I hope this tutorial on tracking distance to help with sacroiliac pain by increasing the strength of your glute medius and the coordination of using glute medius and avoiding hip hiking helps you with your chronic sacroiliac joint pain problems.